Okay,
Uh, Great. Cool.
we've got our recording on. Over to you, John.
Okay, thank you, Charlie. So, just an introduction. I'm John Hasty. I am the CEO of Pathfinders, and I've also been employing BAs since 2009. So, quite a few years of experience. But so I'm going to be talking about how to manage bad treatment from BAs. So, in an ideal world, everybody who works in care would treat us with care and respect, and if anybody didn't, we'd just be able to get rid of them. But in reality, it's not always that easy. That sometimes we gotta prioritize our own kind of safety and well-being, really. Um, so yeah, I'm gonna talk about like bad treatment. When I'm talking about bad treatment, I'm thinking of all sorts of things, really. I'm thinking about like people that raise their voice or talk to you aggressively, people that kind of act out in their behavior. Maybe their behavior's aggressive, maybe they're rude, maybe they're disrespectful, maybe they don't respect your privacy, or they share details about you that you don't want them to. Maybe it's just something like they're unreliable and don't turn up on time and keep kind of just well yeah disappearing or kind of like going off sick all the time. Um, so there could be all sorts of things that might happen. So one of the easiest ways to deal with this is by preventing it from happening in the first place. So there's some things that I think we can do to do that. So I think it's about when you're starting out with a BA, just being very clear about expectations you have about behavior and how they act in your home. Um, and I think nipping things in the bud at a very early stage. So I think people are more receptive to feedback when they've just started the job. Okay. So that's usually the best time to tell them, actually, I prefer it if you don't do it this way. Or like, I'd rather you didn't do that. I just being very clear from the beginning is kind of part of their induction. And I think Charlie's written some excellent BA resources and guides, which will be releasing soon. And some of these cover things like good communication with BAs. And I think there's some excellent tips in there. Um, and yeah, I think the other thing to to bear in mind is that you have employers' liability insurance. That they they have helplines that you can contact. And it's often good to do that at a very early stage, so that they can give you advice on how to deal with bad situations. And I think it's good to keep records of everything. So, like, you might have a good relationship with your PA. Can you, maybe they're a bit unreliable, but, you give them a bit of a break to begin with. But if you make sure you keep records of, like, everything that they're doing, it means that, like, should that situation change, that you already have the information that you need to do something about it. If you just kind of like forget about it and let it go, when you suddenly decide like it's a problem, then you may not have like the records and the information to say, you know, you've been sick this many times, go for this period. This is like excessive kind of thing. Uh, yes, absolutely. Communication is very difficult. When speech is difficult, I'm finding that more these days. I get my speech didn't used to be affected at all. It's only slightly affected now, but it's still like it has made a difference for how I communicate with my PA's grammar. So I think, you know, think about what you could provide in writing in advance in terms of expectations, grammar, guides, like just make sure you allow yourself enough time to communicate with the PA as well, I guess. So yeah, but now I'm gonna focus about kind of if somebody is behaving badly, like what do we do really? And so I think it's always about the context. So I think first of all, we need to think about what has happened and how serious is it? Because, you know, if we're talking about like serious abuse or aggression, like you should never have to experience that. 'Cause when it's safe to do so, you should always deal with that promptly and generally remove the offending person to like give you feel at risk or in danger in any way, then it's important that you just deal with that immediately. But obviously not everything qualifies as abuse, but it could still like spoil your day or if it's ongoing, it might feel like it's ruining your life. Or maybe it's just a bit annoying. But yeah, in those cases, you need to think about like how you want to respond to that. So I think it's being very clear about like the different types of things that could be going wrong. I think other points of context about is about the individual. So like, are they treating everybody like this? Or is it just you? You know, is this personal? Or is it just you know, are they just in a bad mood? Um, and I think about the individual as well. Like, have they have they always been like this? Or has something changed? Either in your life or in theirs. Like, I remember having a PA who was like, God, well, he was fine to begin with, but then I moved house and his commuting time became a bit longer. Uh, so he was always clock watching. Uh, he couldn't get out the door fast enough. Uh, kept making comments about like how long the shift was and that kind of thing. Uh, it was because I'd moved, and it was like that changed the situation. In the end, we we talked about it, and he agreed that the job wasn't really working for him anymore. And he agreed to look elsewhere, and that's how we resolved that. But yeah, it could be something in their life that's changed as well. There's, there could be family problems, could be anything, or financial problems, or anything really that could change how they're behaving. It's also worth thinking about whether they are consistently treating you badly, or do they have some good days and some bad days? Um, that might be something that you can look at. I think also, think about what good qualities do they bring to their role that you would miss if they weren't there. I think sometimes that can help for you to like think about this bad treatment because like, yeah, okay, that's something like I don't mind putting up with because I value them in this way. But not that I'm saying you should have put up with bad treatment, but I think sometimes you just need to balance what's good and bad, and sometimes just thinking about their good qualities might make them a bit might make it seem not quite so bad. I think also, I'm thinking you should do all this thinking before you actually start communicating with BA. Just kind of reflect and think in your head about these things. So think about the alternative to ke- employing that individual. You know, worst case scenario, they leave. Like, what does that look like for you? Or even they get fired. So I think about what you're concerned about having to do a disciplinary process. What are your concerns about having to start recruitment again? And what would be like the best outcome of recruiting someone new? And what would be the worst outcome of recruiting somebody new? And then I think, think about how those challenges weigh up about how you feel about your PA and the way they're behaving. Because I think it's like everybody is going to think about that differently. And I think you need to be honest with yourself as well. Like, you might be dreading having to do recruitment, but actually, if you really think about it, it's not too bad. Or it might be something you just couldn't bear to think about, so you're more willing to tolerate certain things. That doesn't mean you can't do anything about them. It just means you're not quite so eager to, like, make them leave, basically. So I think thinking about all of that, that you need to decide what you actually want. So think about everything and think about what would be your best outcome of, like, dealing with this issue. And what could happen if you address the issue? And are you willing to accept that outcome? So, for example, like, you may have a feeling that if you raise something with your PA, they're just going to quit because they're in that frame of mind. So, are you willing to accept that outcome? And conversely, what could happen if you didn't address the issue? And are you willing to accept that outcome? So, it might be that you don't address it and it just gets worse and worse and they become aggressive and hostile and your safety could be at risk. So you really need to think about what you want and kind of what could happen really. Um, with all that being said, I think you need to remember that not everything is in your control. So there are some things that you just can't control. So you might bend over backwards to make things better for the PA, to change their situation so they're happier at work, but they might leave anyway. Uh, Also, you might do everything you can if you realize that certain things trigger the PA to behave in this way. Like, you could do everything you can to avoid that. But there could be something outside of work that triggers them. And then they come into work in a really bad mood. So I think just bear all that in mind and then communicate with the PA. That's really the only way to deal with it. In whatever way you can communicate. So yeah, I would say you should kind of prepare and think about what you want to say, and then you should think about when you want to say it. So you got to pick the right time. You can't be in the middle of doing a care routine. You may want to schedule it with them, or you might feel it's better to just do it like when they're in, because you don't want them like thinking and mulling it over like what you might say just by scheduling something. You might put them on edge. And usually what I do is I uh, get them to come into my room just by themselves. Can we have a conversation about whatever it is? Come on. I do say if it's not a good time, then we can always schedule another time. Um, should always consider the way they want to communicate. Do they prefer messages or do they prefer face-to-face conversations about things? Like, for example, if I know like somebody's not working out who I've just recently taken on and they're still in their probation period, sometimes I decide I don't want to let them go in person because I don't know them well enough to gauge their reaction and I don't want to put myself in any danger. But I think it's important that, yes, obviously face-to-face communication is ideal, but sometimes it's not practical, and I think you be shouldn't be afraid to use other communication methods if they're going to be safer or if they just work better for you. So with all communication, it needs to be calm and non-emotional. It needs to be clear. You need to get to the point. Um, and it needs to be constructive. You need to be coming with solutions or suggestions and actually just trying to resolve the conflict rather than just assigning blame. Um, it's always best to ask for the BA perspective first. Sometimes it avoids you having to say what you've rehearsed, kind of thing it might be. But you actually speak to them, you say, how are things going? And they might come and say, actually, I've decided they're not going well, and I'm moving on. I've got a new job, and actually, let's let's resolve your issue for you. Good. So it's always good to let them speak first. Good. Yeah, do check out Charlie's communication guide when it's ready, because that's very useful for how exactly to communicate. And I think you need to be sensitive uh, to them, to how they're feeling, but that cannot stop you from saying what you want to say. So I think you still need to persevere and say what you need to. I mean, it might be that it's obviously a bad time. Okay, there's definitely going to be a better time, but sometimes there is no good time. I think if you do expect to have a bad reaction and you're doing it in person, you should always have another PA nearby, maybe in an adjoining room or somewhere they can't hear the conversation, but you could still get their help if you need to. And I think, if you are feeling really angry or frustrated, one thing that I do is I talk to ChatGPT because I know it's just an AI, but it's allowing me to air my frustrations in a safe way. Kind of, it also kind of, it does validate how you're feeling. Because all you need to do. So I think it could be good to do that rather than doing it to a PA. Um, if it is going to be a bad conversation, you probably shouldn't expect them to like have that conversation then work full shift. You, if you can, you should probably give them paid time off to process things, or otherwise just do it at the end of their shift, uh, if possible. I think you should also just think through in your head, like, what would you do if they screamed at you or shouted at you? What would you do if they burst into tears? What would you do if they got defensive? What would you do if they got aggressive? What would you do if they kind of like made up a false report about you, kind of reported you to the local authority or to your CHC? Um, what would you do then? And what would you do if they just quit on the spot? So I think it's worth thinking through some possible scenarios and what you would do in those situations. I think it's also important that you don't react to their reactions. just keep things calm. Not just with what you're saying, but also with how you're responding to what they're saying. Even if what they're saying might be quite rude or inflammatory. Um, I think you should also think about who you're going to confide in or vent to about this when you've had this conversation, because you don't want to like have this conversation and then they change like with another BA and the next BA comes in, go like, I need to tell somebody about this. Do you tell that BA? That's not a great kind of idea because you don't know what's going to be communicated back to the other person. I think you should try to stick to your script as much as possible. And as I said, if you've got nobody to confide in, ChatGPT can be a decent substitute. But I think it's better to have a family or friends. So that's basically what I want to say. Just to summarize, I just want to say it does take a lot of practice to do this kind of thing. Because you won't always get it right. I know I definitely didn't when I was younger. But I think as long as you manage to avoid being taken to tribunal, then I think you're winning. I think it's a complex balance, and you're not always gonna get it right. Like, if you reacted to every bit of bad treatment, you probably have no PAs at all. But equally, you can't like live your life in fear of what might happen. That you gotta prioritize your well-being. And really, if they react badly or aggressive, then quite frankly, they're not suited to this kind of work. That being said, everybody has off days, so don't overreact if it is a genuine one-off from a PA that you really value. Maybe they need a mental health break or something like that. But yeah, these kind of things, they can always happen from time to time, but I think, like, as long as you stay calm and, like, yeah, don't kind of escalate the situation, like, or overreact, basically, then I think you should be able to kind of navigate it safely. So yeah, that's everything I wanted to say. I hope that was helpful.
Brilliant. Thank you very much. I will just turn the recording off.